My name is Olivia Preston, and today I will be discussing mental health funding per capita in correlation of incarceration per capita. The Harvard theory found that men of age 19 to 23 who struggle with mental health were more likely to be incarcerated due to there being a decrease in mental health funding. The mental health funding impacts individuals who rely very heavily on the state to receive the help that they need. The men who stop receiving Medicaid are 15% more likely to commit crimes than those who continue with their health care. They also found that the recommit crime is higher in men who have mental health illness than those who do not. The Brown study found that the recessions affect everyone drastically, but they affect mentally ill individuals even more so. And that's due to them not being able to receive the Medicaid that they need, and that leaves them on the streets or to further incarcerate themselves. And they also found that when services are cut, the prisons and jails become dumping grounds for mentally ill individuals, which is due to them not being able to go to a mental health facility because the staff there is not obligated to have enough individuals to suffice for the individuals coming in, which leaves them to be able to give them a diagnosis and then turn over them back to the streets, and then the relapse just keeps occurring. And so police officers have resorted to incarceration as the first method instead of the second. And they also found that the spending needs to be more understanding on the per capita spending in order to further digest their correlation because their data was inconclusive. The psychiatric study found that police officers lack the training in how to handle a mental health situation, and that police officers have a legal obligation to keep people safe. And with the funding that mental health facilities have, they can't keep up with the ratios. So to ensure the safety of civilians, police often refer to imprisonment, again, due to there not being enough staff in the facilities to withhold the amount of individuals that they are receiving at such a high rate. The gaps in the literature was for the Harvard theory was that they didn't consider all individuals. They only were considering men, which already excludes half of the population. And then the age category of 19 to 23 disregards all members who are over the age and under the age, which is a very big gap in their literature. The Brown study only provides one perspective of the recessions and how the mentally ill individuals suffer from lack of funding. And the psychiatric study, they only provided the one perspective of police officers and how their funding of their own staff members are being decreased and not allowing for them to provide the necessaries for the mental health individuals. My study was the increase in funding per capita leads to a decrease in incarceration. So the higher mental health funding per capita in the United States, the lower the incarceration rates per capita in the United States. And my theory was that mental health should be treated as a public health issue. So my research design was conducted over all 50 states in the year of 2020. And I gathered all of my information through the National Rehab Directory and World Population Review. The National Rehab Directory, however, was a broader data spectrum than I had anticipated. It included all mental health funding, which includes the drug use as well. And I had really hoped to just specify on the facility and staff members and Medicaid that was going through individuals. So all of my numbers was conducted through a bigger ratio of funding than I had originally anticipated. So the causal research was a correlation between my independent variable of incarceration rates per capita and my dependent variable of mental health funding per capita. So my results in conclusion, my data shows that there's a large correlation between incarceration rates per capita and mental health funding per capita. However, there was a correlation of the higher the funding, the more incarceration rates per capita. So I reject my hypothesis. However, my p-value consisted of 0.001. So my correlation was very high and it was very significant, meaning that there was almost without certainty a correlation between the two And the mean of the incarceration rates was 21273.3 with a standard error of 4.37. And the mean of the mental health increase funding per capita was 8.11 E.08 with a standard error of 3.43. So all of my data shows that there was a high correlation. However, there was a gap in my data due to there only being a broader data set spectrum than I had anticipated in my regression. So my data was more inconclusive than the data that I would further research if I was to continue my study, which would be over a span of a quasi experiment of 16 years. So then I could include a 4 terms of a presidency so I could see the fluctuation of mental health funding per capita and see the decrease as well. So then I could really see the regression correctly and have a correct amount of data. If I was to start this now, then I could start to get the correct amount of data so that my data would be conclusive with the amount of facility staff and Medicaid numbers that I was originally anticipated.